Hey there. Welcome. It is good to have you with me today in this special mini class where we are talking about iridology. Just a little reminder at the outset, I'd love it if you would do me a favor, and that is if you're watching this on the replay and on YouTube, if you would do me a favor and like it, drop a comment, share it, subscribe to my channel. All of those things help to make my channel more visible and helps to get this important iridology information out to more people who are looking for it. Thanks for your help with that. Today we are talking about, do irides change? So I need to start out with asking the question, are you familiar with constitutional iridology? If you are, give me a yes in the comments box. Hopefully you can see the comments box and you've been playing with that already. Love to see a comment in the comments box. Are you familiar with constitutional iridology? Yes. And if you're not, put no, so that I know what I'm working with. The more I know about where you're coming from, the more I can tweak this presentation on the fly for you. All right. So also remember, if you have any comments or questions, drop them in the chat box. And if they're appropriate to our topic today, I will absolutely try to make time to answer them for you so that you get the material you need. All right, let's start with the disclaimer. This information is meant for your education only. It's not meant to diagnose or prescribe. You are responsible for any results you get, good or bad, that result from using this information. So thank you for being here, and thank you for accepting the responsibility for learning this and for using it. Just before we dive in, I wanted to share some comments from a course graduate, someone who's taken my dynamic iridology course. And this is what she said. This is Jack Stegman. I'm excited and thrilled to be in this class. I'm a certified functional nutrition counselor with a healthcare background. I thought with all the A and P classes I have taken in the past that I knew a lot about the body, but I am learning so much more. Judith is a wonderful teacher, so knowledgeable and patient with my endless questions. I would recommend her class to anyone and can't wait until I certify and can practice iridology. Really appreciate that. And just a reminder that our next dynamic iridology course is starting on June 27th. If you already have a college level anatomy and physiology course under your belt, then I would invite you to grab that link, tinyurl.com/dynamic-iridology, and schedule a time to chat with me about the course. This course is for health professionals and people who are becoming health professionals, which is why you have to have the A and P, the anatomy and physiology, under your belt to begin with. We can't go very deep if you don't know how the body works, right? And okay, I am trying to copy and paste that link into the chat box, and my computer is not coordinating, or is not cooperating. I mean, there we go. All right, there we go. So now that link is in the chat box. I only accept 10 students per course because I really believe that the quality of the education is dependent on each student having enough individual attention. So we're going to start with, how do you prepare to learn iridology? And of course, that means that you've got to have a college level A and P, because that lets us go much deeper. And oops, there we go. Because we go way deeper than one marking equals one problem. And we are going to work around to the idea of, do eyes change, in just a moment. We need to get there. We need to understand the organ pathways, connections, and interactions more fully. We need to create logical, sequential programs rather than throwing everything we know at our client all at once. And this is what I teach you. I teach you all of this in dynamic iridology. So now let's look at how some eyes have changed. I want you to look really, really carefully at this set of eyes. We're going to look at another set of photos of this exact set of eyes. I want you to look at them closely, just look at the color, look at how the color is sitting, look at the skin tones, look at everything that you can see here, and then look at this. What has changed? These sets of photos were taken 18 months apart. What has changed? What differences do you see from one set of photos to the other? So this was 18, the original photo, and then 18 months later, we have this photo. What do you think has changed? I'd love to see some comments in the chat box here. So in that intervening time, this fellow had been diligent with making some dietary changes. He'd been diligent with taking supplements. He had worked really, really hard. And so what we see here is something very interesting. And that is that actually what has changed is the technology. The camera has changed. The light source and quality has changed. His eyes did not change in response to supplements we were doing or dietary corrections we had made. I had learned that eyes would change when I started out as a Jensenian iridologist. And it was 10 years of working as a Jensenian and getting frustrated with not seeing the eyes change the way I was taught they would, that almost made me leave iridology. But that's when I was blessed to learn constitutional iridology. The image on the left of your screen was taken with an 8 megapixel camera, which was state of the art at the time. It had an incandescent ring flash. And the fact that it was an 8 megapixel and incandescent ring flash, the color settings inside the camera, and even the color settings within a computer, actually back here, yeah, we were just taking it straight to computer, is what has accounted for the change. This was a 24 megapixel camera with an LED flash, which is going to make the eye look a lot bluer. And notice even the skin tones, they look more pinky blue. In the original photo, they look more orangey. So what we see here is not a contrast of before and after, that we've cleaned his body out. What we see here is the contrast of how technology can be used to manipulate what would appear to be an end result. Now, I am personally very concerned about this because there are a lot of people on social media who are using photos just like this to claim that their herbal programs or their health and wellness programs are changing eye color, when in truth, they are not. They are not. So this is important. Now, this doesn't mean that eyes don't change, but it means they change in response to other things. They do not change in response to let me rephrase that. The irides do not change as in show that things are cleaning out in response to our diet or our supplements. We're going to dive into this a little bit. So let's look at where I'm coming from. I am a professional nutrition coach. I'm affiliated with 2 Canadian associations, the Canadian Association of Holistic Nutrition Professionals and the Canadian Association of Natural Nutritional Practitioners. And I'm also a master herbalist affiliated with the Alberta Herbalist Association. I've been a wellness coach since 1982. So I've been at this for a lot of years. Several years ago, and these badges don't reflect how many years, when I left the Jensenian style of iridology and moved over to the constitutional, I became affiliated with the International Iridology Practitioners Association. As a certified iridologist and a certified iridology instructor from them, I need to update my credentials every 2 years. I need to provide CEUs, and I've got to stay on top of things. And so we get new badges every 2 years. I've just got the last 4 years of them up here. But I have been a member of IPA for many, many years. I started studying holistic healing in 79, started working clinically in 1981. I've studied iridology under 8 different instructors, 3 different styles. And of course, I'm now certified, one of only 8 level 3 certified instructors with the International Iridology Practitioners Association. There are many certified instructors who have certified level 1 and 2, but only 8 of us have done level 3. So I've also designed and taught herbal courses, prenatal education courses. For a while, I was a certified prenatal educator. That was a lot of fun. And of course, I've designed and taught iridology courses. So I've got a lot of teaching experience under my belt as well. So let's look at what are better questions to ask here. The best question is not, do irides change? But the question is the question should be, what changes do we see in irides? What causes those changes? And what do those changes mean? Right? These better questions get us better answers. Do you agree with that? We have to ask better questions. Because, we do know that irides change. They just don't change the way North American iridology has claimed for the last 60 or 70 years. In the many years that I've been an iridologist, I've seen a lot of developments in iridology. I've seen a lot of research, especially with the constitutional iridology style. Haven't seen nearly as much research on the Jensenian front, but on the constitutional style, a ton of research. And the more I studied constitutional, the more it made sense to me, the easier it was for me to do an iris analysis that was relevant to my clients and helpful to them progressing their health. So important. So, are you ready to learn about what constitutional iridology teaches about the changes in irides? If you are, give me a yes in the comments box. Give me a yes if you want to learn more about these changes. Thank you for that. Thank you so much. One of the changes we see, and these are the same eye. Now remember, I just discredited photos from different cameras, different settings, different lighting. Absolutely, I totally admit that up front. These are the same eye. We look for key markings in here and we find them. Notice that the pupil size changes the appearance of certain markings. It makes, when the pupil is smaller, these kinds of markings look narrower. When the pupil is larger, these kinds of markings look fatter or wider. But you'll notice in this image that was taken again with an incandescent flash, it shows, and it was taken 20 years prior to the image on the right of your screen. Notice down between about 30 minutes and about 35 minutes, we have no pigment here in the original photo. 20 years later, we have an accumulation of pigment. Now, again, when we see something like this, some people would be tempted to say that based on eye color, this person has done some good work, but based on this pigment, they now have toxicity. Are those the kinds of things that you've maybe seen or heard in comparison photos on social media? If you've seen and heard things like that, give me the word comparison in the chat box. So when we look at this and we see this, what does this actually mean? Okay, so we've discredited the idea that this person would have cleansed. We know that the color difference here is because of the technology. But this pigment would have shown up in the image on the left if it had been there 20 years ago. So this pigment tells us two things. The color of the pigment tells us which organ genetically wants to be causing problems in the body. The placement of the pigment tells us which organs want to be affected or are going to be affected by that first organ being out of balance. So I describe it as the pigment tells us the organ of origin. The placement tells us the organ of destination. So when we see this, it tells us that this gentleman's liver wants to wreak some havoc. And specifically based on the placement, most of that havoc is going to be on the kidneys and perhaps the adrenal gland. Very interesting. So when we see this, we need to think, what does the liver do? How can the liver impact kidneys and adrenals? So what symptoms might we see? When we understand those things, we then understand that we maybe need to approach this problem from two angles. We maybe need to go in and do some kidney and adrenal support. Now, that might be by food choices, it might be by herbal choices, but we also need to do something to help that liver be happier. As we do these things, what we will see is this gentleman's symptoms will quiet. They will go away, but we will not see the pigment disappear. Does that make sense? If that makes sense, give me makes sense in the comments box. If you've got Jensenian background, this could be mind-blowing for you. If you are looking for new information, then you are getting it. If you're brand new to iridology, hopefully it's still mind-blowing for you. This again is the same person, again, taken with the same cameras we used in the previous set, taken 20 years apart. This is one of my boys and one of my sons. And what we see in the original photo, which was taken when he was a young teenager, these pigments are not present in this eye. So 20 years later, when I got a new camera, he came and sat for photos and we see this. So it gives us the same kind of thing. So question in the chat box, does that mean that once they are there, deposited pigments never resolve? If by resolve you mean the pigments never go away, that is absolutely true. And that is true because the pigments are not there because the person has done something awful to their body. The pigments are there because the genetics said they are supposed to be there. Think of it as like my hair has not always been gray, right? I've done lots of good things to help improve, to keep my health good. I mean, I've been in this for over 4 decades, but my hair still eventually went gray. So question in the chat box, how then can we establish an improvement? By the client's symptoms. This is where understanding anatomy and physiology is absolutely crucial. The liver does over 600 different jobs. Not that we're going to have a quiz to understand what all 600 are, but we understand basics. Phase 1, phase 2 detox, turning carbohydrates into cholesterol, into hormones, denaturing the hormones once they've done their job. That's about 4 jobs right there. Storing iron, storing fat-soluble vitamins, functions with the immune system with its own macrophage system. There's so many things it does. So as we know those symptoms, or as we know what the liver does, and we understand the impact of those functions on different organ systems, we can see if we are making progress. So for example, I think I've got another photo later on that's a really good example of improvement. Let's just hop back to this gentleman. At about the age of 40, he began developing itchy skin. That correlates beautifully to liver not handling its detox properly and possibly not handling histamine neutralization properly, right? And so we monitor him. We constantly are experimenting with different dietary switches, getting him off certain things that might not be good for his liver or his kidneys, doing things to support his liver and kidneys more. And we see that when we've made changes that are good, that are supportive of liver and kidneys, the itching decreases tremendously. There's no rash, there's no eczema, it's just itching. And we see that when he backslides, the itching comes back. So we know that by doing liver and kidney support in various ways, we get progress, right? I'm never going to turn my hair back to gray, even though I do all kinds of supplements that trigger glutathione production and things like that. I haven't seen my hair go back from gray to its natural color. And so we actually don't care what the eyes are doing as far as things disappearing. We want to see symptoms improve. That tells us how the body is functioning. Does that help, Dustin? So again, this young man, as a teenager, didn't have those pigments. 20 years later, he has those pigments. Right now, family history here is there are genetic liver concerns with this family. Gilbert's disease is something that has been passed down through his bloodline. And so we already know that there's a liver enzyme issue with dealing with the conjugation of bilirubin, correct? And we know that that can lead to certain other symptoms as well. And so with this young man, well, he's now not so young anymore. He is about 35 years. Well, I guess that is young. He's about 35 years old. He's not a teenager anymore. Let's put it that way. And so as he's a client, we are continually working with him. You know, as a teenager, he went through a rough patch of lots of alcohol and coffee and junky diet and things like that, which did not put the pigments into his eyes, but it certainly did not support his liver either. And so as he got himself straightened around, we've been working more with, yes, I'd like to see focus more on leafy green vegetables to support your liver. I'm glad you're not drinking alcohol anymore. You decided that wasn't helpful. That's great. Can we get you switched over to a variety of herbal teas as beverages rather than using black tea or green tea? So we've been crafting his lifestyle and his diet to be one that he can maintain for the long term, to be liver supportive, to reduce the negative impact of any liver predispositions on other tissues in his body. We may see a lipemic diathesis. That is this white ring. Now, if you've got a ginsenin background, you might have called it a cholesterol ring or a sodium ring. We now know that that's not actually an absolutely correct term. Lipemic diathesis is the ophthalmological term for this. This is in the cornea. It's not in the iris. It accumulates over time. And this actually has a direct correlation many, many times to liver function. It tells us that the liver may not be processing carbohydrates properly. And that can then go in many directions. It could go into a cholesterol triglyceride issue. It could go into a type 2 diabetes situation. And so when we see this, it's not that we are telling a person, you are blocking arteries, because we don't know that. I don't have that kind of x-ray vision. But it begs questions then. Have you had your hemoglobin A1C checked lately? Have you had your cholesterol checked? Have you had your triglycerides checked? Is there a family history, personal or family history, of liver concerns that would push things in that direction? Now, again, when we look at this eye, we've got layers of information. And just one layer that we're going to touch on is we've got this brown pigment, right? We've seen brown pigments before in previous eyes. This says liver has that cranky attitude. It may want to create problems. And in this case, it's wanting to create problems for, oh, just let me get my iridology map. You know, I have purposely not memorized an iridology map. It just didn't make sense. In all of the maps that are on my desk, do you think I can find one? Oh, well. This is a right iris, so this is in the sinus region. And so with that, we know that liver wants to affect sinus. How could it do that? Well, it might show up as more mucus congestion in the sinuses or sinus-related allergies, right? So we know liver wants to be a troublemaker, but it also wants to not manage its carbohydrates very well, right? So we need to ask those questions. Lots of other details here in the sclera as well. Pupil shape may change. Okay, so the pupil shape equals spinal alignment. Now, this can changes very slowly. If someone has a flattening on the pupil, it suggests a long-standing spinal subluxation. Okay, so this is not inherent. And it does suggest that if this client were to do all the right things, as in very intense spinal care, the pupil could be made to be round again. So with this, then, we also want to be aware that this shows us exactly where, within one or two vertebrae, where the subluxations may be. And when we understand that, we also then understand how the nerve feed to the organs that are fed through the nerves that come off the spine, where those subluxations are, will be impacted. So questions. So then we can use iridology to monitor wellness without physical manifestations before they are being expressed. Yes, yes. So the irides show us genetic potentials. The sclera shows us what the client is doing with it right now, where the nurture points are in the body right now. Absolutely. So the eyes tell us what questions to ask. This is where we often ask, is there a personal or family history of? Okay, so that's really important. I always want my clients to come in with a list of things that they are concerned about. So they'll come in with usually one key problem, but then as we talk, there's 4 or 5 or 6 other problems. And because of the understanding of anatomy and physiology, we can see how these problems all tie together. And as we see that, then we can look at the eyes and we can look for those genetic predispositions. Where are the markers in the eyes that specifically teach us about why our client has these symptoms? Then we can ask deeper questions going in that direction to come to the root of the problem and create lifestyle and dietary and supplement recommendations that they can maintain, hopefully for the long term, to regain their health. And it's the regaining of the health that we want to see. I don't care what the Irides are showing me then, right? I'm not looking for a change there. I'm looking at the Irides to give me information about where and how to understand the problems my client has. It sounds like this is resonating with you, Destin. That is so, so good. So good. So again, when we've got these flattened pupils, we want to inspire our client to seek proper spinal care, whatever they are comfortable with, so that we can get that nervous system all working properly through the spinal cord and the nerve beads to help us correct any imbalances in the body as well, right? Blood vessels change in the sclera. So as we look at this from 1997 to 2018, we looked at this fellow before. This is the one that had the pigment that we looked at very early on. This is where we can see changes, right? So as we look at this, we have this in 1997, we have this very heavy blood vessel coming up here. And you'll notice that as we come down here, it's a little bit fainter. It's not quite as bold. It's kind of changed its shape. So it tells us that things are happening. But look at down here. We've got a blood vessel that's showing up, but 20 years later, it's much thicker. This is teaching us that there is, especially with this one, this is teaching us there is increased congestion in the circulation in the organs that are reflected in this area of the sclera. So then again, this is a current situation and it might still be subclinical, right? He may not have symptoms in that area yet, but when I see this, I am going to build into my recommendations for him things that are going to work on this area. It might be to include certain foods. It might be to exclude certain foods. I might tuck in a herbal formula that will work on this area to help support it so we don't end up in trouble. Justin is saying definitely can see the application. I've wanted to learn for a long time. Also had exposure long ago to Jensenian iridology. You know, I gotta say, Jensen did us so many big favors, right? He kept iridology alive during the Cold War years when the research and the forward motion from behind the Iron Curtain, like primarily Germany and Russia, that research wasn't coming over, but he kept it alive. And it was once we could start getting information from Central Europe again, that we were able to learn constitutional iridology and move forward with the research. So we love Dr. Jensen to be so brave and so dedicated to do such an amazing job pretty much on his own, right? That was pretty much a one-man fight that he put up. And we're grateful for that because it opened the door for us to be where we are now. So ways irides do not change. Now, in Jensenian terms, we were taught that when we saw a lacuna, or what he would have called a lesion, that had these lines in the middle, these fibers in the middle, that those were healing lines. But we didn't have before and after pictures. We didn't have a picture that showed this open space with nothing in it. So how do we know these were healing lines? We now know that is not the case. These are not healing lines. this structure of the iris, it's very, very thin, but it is made up of layers of trabecula, or these are actually blood vessels coated with collagen that make the bulk of the trabecula, right? The trabecular mesh. And we've got layers of this. So when we see an opening like this, we are actually looking at what is beneath, what is down a layer or down 2 layers. And the more shading we see in these openings, the more layers we are looking down between. So we've got that opening, I can't do this with my hands very well, but we've got an opening in those layers of fibers, and the more layers of fibers that are separated and lined up and separated, the deeper we're looking, the more shading we're going to see. That gives us information as well. So this is not an indication of healing. That has always been there, and it always will be for that person. It certainly does give us a suggestion of areas that may need support. But again, depending on what my client has asked for help with, I may or may not pay any attention to this area right now. If this isn't relevant to the problems my client has brought into me, I'm not going to pay attention to it until we've resolved my client's current concerns. I learned long ago, focus in an appointment is crucial to progress. Another way irides do not change is lacunae do not get smaller. What we didn't pay attention to 4 decades ago was the impact of the size of the pupil on how the fibers are manipulated, if you will. So when we look at the structure of the eye, and we're seeing again that lacuna, and this pupil is very big, this iris tissue has had to compress. And because these fibers are sitting on the top surface, they have as things compress, they're going to look like they are changing shape. They're actually anchored down. They don't change shape. They can't change shape and disappear. As the pupil gets smaller, you'll notice it looks like this is changing shape, but this is just the fibers being stretched out a little bit. When the pupil, again, different cameras, same eye, different camera, brighter light, maybe 20 years later, we now have the pupil is very small because of the impact of light. And notice how this looks very different from this. But again, it simply is because those fibers have stretched out. So the volume of this lacuna is the same in each of these pictures. It's like taking a balloon that you compress. You haven't changed the volume of air inside it. As you stretch it out, you still haven't changed the volume of air inside it. It's still the same thing. It's just the pressure on the ends that makes the borders look different. Does that make sense? If that makes sense, give me a makes sense in the comments box. Yeah, fantastic. Fantastic. And again, we've talked about iris colors don't change. Sometimes what you will see, and it might look like it's made the iris color change a little bit, is if someone, for example, had jaundice and the white of the eye was very yellow, we do the work on the body, we work on the liver, we get that jaundice clearing up, we get the liver conjugating the bilirubin more effectively, the white of the eye clears up. That is going to make anything next to the white of the eye look like it's changed color. We've all seen these things on the internet where, you know, they have 2 colors together and they ask what color are they, and you know, we all perceive color differently. That's one thing, but also the way the light is hitting it will change the perception of color. So we know that color does not change in the irid, except that if we have that different color in the sclera and we clean it up, it may change the contrast, which may make the iris look like it's changed color. So this is Kimberly Zadalis, and what she said, she's one of my certified graduates too. She's certified through IPA, which is, this is a screenshot from the IPA site. She said, if you're wondering which iridology course to take, you can stop looking, you found it. Judith Cobb is an excellent instructor with many years of experience. She's a caring and compassionate person who is dedicated to the field of iridology and her students. I personally practice both Eastern and Western physiology medicine and was very impressed with the layout of her program. She makes it easy for her students to balance work, life, and study. Kimberly has a master's degree in radiology. She's a radiology assistant in a clinic, so she does the imaging and shoots it off to the doctors. But she also has her own wellness clinic where she works with clients one-on-one, again, using Eastern and Western ideas to help bring them back to health. So I love that she valued the course with all the training she had. She values the iridology. So I love that. So quick introduction to the dynamic iridology program. And this is the only online fully mentored program for health professionals, people who've got that anatomy and physiology under the belt. That's how I define health professional. You've got a college level anatomy and physiology course under your belt, preferably with a grade over 80%. And included in that would be nutritionists, herbalists, naturopaths, RNs, RMTs, EMTs, PTs, who want to streamline their clinical work without sacrificing client care. I see far too many holistic professionals see the client, gather information, go off and spend 2 or 3 or 4 hours writing up reports and doing research to bring information back to the next client session. But in truth, they're not being paid for the time that they are doing all that research and report writing. Using iridology the way I teach it, you can do your assessment and your program writing while you are in your paid session with your client. Forget writing reports. Get it done when you're with your client so that you can educate your client about everything they need, and do it in a step-by-step fashion from one appointment to the next to the next. So you are building and crafting the wellness program in a way that they can actually stick with. Now, why is that important? Because it's going to cut out your unpaid overtime, right, to create programs. If you spend 4 hours writing a program, you're giving your client way too much information and you're overwhelming them. When you overwhelm them, they can't do the programs. And because now you're creating your programs in your client sessions, because you're doing it the way I teach you, you're giving your client the information they need in bite-sized pieces that they can actually implement successfully, create success, and create long-term retention. Any clients who haven't been able to manage a program will not come back. They don't want to tell you they failed. But if you've given them 2 or 3 precise small steps to do that will have an impact, they want to come back. They want to tell you they did well. They're getting these results. What do we do next? Right? And that leads to long-term retention. I've got clients that have been with me. Some of them started with me in my Jensen days, and I'm amazed that they stuck with me through that. But I've got many that have been with me for 30 years because of this way of using iridology. So dynamic iridology, which is my version of constitutional, will help you do faster assessments, help you be more accurate, help you create better and faster rapport with your clients, and it eliminates the need for intake questionnaires. You still need name, address, phone number, the release form, the informed consent, but don't ever give your client a questionnaire to fill out. Nobody likes filling them out. Really, seriously, I've never had anyone complain about the fact that I wanted to talk with them and ask them questions rather than having them fill out another form. So the next course again is starting on June 27th. And if you've got that A&P under your belt, and if you are interested in learning more about the program, having a tour of the student site, and possibly talking about enrollment, grab that URL, tinyurl.com/dynamic iridology, and let's have a chat about the course, about your goals, about where you're at, about where you want to go with iridology. If it seems like a good fit, I'll invite you to enroll. If it doesn't seem like a good fit, I'll coach you in other directions, perhaps to prepare you to come into the course at a later time. Karen Choate was one of my first certified grads, and she still hangs out with us. I'm so appreciative of that. She says, Judith, Cobb has been one of the teachers who's made a difference in my life. She's a born teacher, meaning she has incredible knowledge to share in her field of expertise, patience with her students, whether you are completely new to the field or a person who has taken iridology courses with other teachers. And most importantly, the passion to ensure all of her students are well-versed, comfortable with what they have learned, and are poised for success. Judith has always been generous with her time and is always willing to discuss any questions that I occasionally have had with unusual cases in my practice. I began implementing what I had learned in her course into my practice before I had even finished her classes, and it has been an invaluable tool in my office. I cannot say enough about Judith and any course that she teaches, and if you are considering studying iridology, look no further. So, I love what you're saying here, Dustin. Great reminders and perspective that I've definitely seen in my years of experience throughout natural, Eastern, and Western medicine. So again, whether you're watching this with me live now or on the replay, if you've got that A and P under your belt and you would like some good information, you want to find out more about the Dynamic Iridology program, grab that URL. Let's have a chat. Let's see if this is a good fit for you and if it's a good fit for you now, and let's get you enrolled if it is. Thanks so much for being with me, and thanks so much for the interaction. I truly appreciate it, and I will talk to you soon. Take good care and have a great day. Bye for now.